Hello, this is Paul Hambleton once again with the Peak Performer Show. Today we're going to be talking about headaches and migraines and other types of symptoms from the perspective of a naturopathic doctor. Today I have Yelena Deshko with me. She's a naturopathic doctor. How are you today?
I'm excellent. How are you?
Very good, thank you. Thank you very much for coming on the show today.
Thank you for having me.
I was wondering, I was reading through a little bit about your biography, and I was wondering if you could tell a little bit about your expertise.
Sure. Well, I'm a naturopathic doctor, and what that means is I address healthcare concerns from a natural or holistic point of view. I see lots of different types of conditions in my practice. I would say that commonly have a special interest in treating female hormonal health, gastrointestinal concerns, and other chronic healthcare conditions such as arthritis. Headaches and migraines are a big one as well.
Great. It seems like you got started pretty young with an interest in this field. Did you have an interest when you were starting out as a child or something like that?
Definitely. Well, I worked in the healthcare field for quite a number of years under one guise or another. Definitely as a child, I was always around older adults that, had a lot of healthcare complaints, and I was always listening to them and how, different types of home remedies that they were trying. So, yeah, I would say I was always interested in it, and then just went along with the biology and other healthcare-related professions, and eventually ended up as a naturopathic doctor. I would say it's definitely my passion. I discovered it pretty young, and I'm very glad to be able to help people from a holistic point of view.
Terrific. So you got a Bachelor of Science degree, and then after that you decided to become a naturopathic doctor. Is that right?
Exactly. So first it's a 4-year Bachelor of Science degree. I'm a major in biology. And after that, it is a 4-year full-time program to become a naturopathic doctor. I studied at the Canadian College of Naturopathic Medicine, which I believe is currently the only accredited naturopathic college in Ontario.
Hmm. And then there was some special internship that you did. Could you elaborate a little bit on the training that a naturopathic doctor does? Because I think it's a lot more extensive than most people realize. And then maybe tell us just a little bit about your specialty that you took.
Okay. It definitely is a lot more intensive than a lot of people realize, because in Ontario, naturopathic doctors are regulated healthcare professionals. We go through a very rigorous training process, very similar to that of medical doctors, chiropractors, and other healthcare providers. So it is a full 4-year full-time program at the Canadian College of Naturopathic Medicine, and then we do an internship. It is usually done at the Robert Shad Naturopathic Clinic, where we do clinical rotations, again, very similar to something that medical doctors would do. And you see a lot of different types of patients, anything ranging from, the common cold to cancer, essentially. So it's definitely prepares you for practice in the real world.
So by the time you graduate, you've had lots of experience in terms of dealing with all kinds of conditions and all kinds of patient profiles.
Exactly. Yes, it's a very diverse patient population, I would say.
Could you tell us a little bit then about the types of services that you provide now as a naturopathic doctor?
Certainly. So as a naturopathic doctor, the mainstay of our practice would be naturopathic consultations, which usually involve a very full health history. We usually do laboratory testing, which involves, regular blood testing that you might get from your family doctor. And we do some specialty testing as well, such as saliva hormone profiles, food sensitivity testing, digestive stool analysis, and then treatment-wise, we focus a lot on acupuncture and intravenous vitamin injections, which not a lot of people have heard about, but that would be one of our practice specialties, I would say, at the clinic.
Do many patients need or require that type of treatment with the intravenous therapy?
Well, it depends on what the patient concerns are, but the treatments are definitely modified based on the patient profiles, and they can be used by, depending on, anything from cancer to even people that just want to boost energy, depending on which formulas exactly are used. I would say a lot of people definitely benefit from this therapy because it is so individualized. I mean, we make up the injections based on the person's needs. So athletes, post-athletic recovery, GI stuff, headaches again. Yeah, a lot of different types of patients would benefit from this type of therapy.
What I personally like about the naturopathic approach is how individualized it is, and you just mentioned that, so that I would imagine that you could have 10 different patients come in with a similar type of symptom, but you're looking at that individual, and so the treatment from person A might be different than slightly different because you're individualizing it.
Exactly, exactly.
So what are some of the most common symptoms, though, that your patients would have?
So most of our patient population comes from, people that are not altogether satisfied with conventional treatments that they're receiving. So a lot of chronic care concerns, which unfortunately most conventional therapies are a little, lackluster about. So things like arthritis, so joint pain, muscle pain, headaches, a lot of gastrointestinal complaints that we see, anything from bloating to irritable bowel syndrome, a lot of hormonal imbalances, infertility, as well as anxiety and depression, which seem to be very prevalent in today's urban population.
Sure. So it's pretty much like what a medical doctor would see, a broad range of symptoms, and you're treating it from and assessing it from the naturopathic doctor perspective.
Exactly.
So you mentioned about headaches, and that's an area that I wanted to delve into a little bit deeper today.
Mm-hmm.
Could you explain a little bit about the different types of headaches some of your patients might experience?
Okay, sure. So there are three major classes of headaches. The first class would be your regular run-of-the-mill, as we call it, tension headache. And that usually comes about from either muscle tension or chronic stress or dehydration. Usually people would experience this towards the end of the day. It's a pain that's all over the head. It's a very diffuse tightness, almost, most people describe it as. It usually gets worse from staring at a computer or a TV, basically exacerbated by stress.
Okay.
The other type of headache that's also pretty common would be a migraine. People usually experience it only on one side of the head. There's generally a genetic component to this, so people usually inherit it from their mom or their dad or it just runs in the family. Definitely there's some lifestyle triggers for it as well. And people frequently experience sensitivity to light and nausea, desire to just lie down, turn off the lights, and it's a more severe type of headache, I would say, than the tension type headache.
Yeah, and you hear people saying like they have a blinding migraine. That sounds appropriate type of comment people would have?
Yeah, it definitely depends on the severity of the headache. Some people would describe it as that just because there's this symptom of light sensitivity, so a desire to be in the dark. I think that's where the term blinding comes from. They just really want to shut their eyes to the world at that point and go to bed, essentially.
Right.
Yeah. Oh, and there's also the third type of headache, which is quite rare, but it's worth mentioning it.
Sure.
It's called a cluster headache. So it's a very small percentage of the population would suffer from cluster headaches. Usually there is a genetic component as well. What this is, it's a very, very intense pain, one-sided. So people describe this as the worst pain they have felt in their life. So as you can imagine, it's severe. But it lasts only a couple of moments. But then after a period of relaxation, it comes on again. So this is why they call them cluster headaches, because they occur in clusters. And this is usually a very challenging condition to treat. Yeah.
So the most common then that you would see would be the general type of
tension headache I would say is the most common, followed by migraines.
Okay. Now, inflammation and diet from a naturopathic's perspective here, how much of a role do you think that they might play in headaches, so the tension headaches or the migraines?
Oh, I would say it plays a huge role. One of the classic hallmarks of inflammation is pain. So pain from inflammation can manifest anywhere in the body, including headaches, but also as muscle pain, joint pain, stomach aches. So definitely inflammation, one of its symptoms could be headaches, combined with other symptoms as well.
So, could you give a little bit of an example on some of these other symptoms that might be related to headaches then?
Sure. So if, for example, if a person is experiencing inflammation as a result of an inadequate diet, so a lot of the times people eat a very pro-inflammatory diet, which means it's very high in refined carbohydrates, so sugar, soda, pop, breads, all kinds of sweets, very high inflammation factor. Not only would they have an increased likelihood of getting headaches, but they would have an increased likelihood of getting various skin conditions, inflammatory skin conditions such as eczema and acne, gastrointestinal disturbances because of the inflammation of the lining of the stomach. They could be more susceptible to injuries, so muscle pain, and arthritis is another common one that's a result of inflammation in the body.
So just so listeners know, when you're talking about inflammation, so to my mind as a layperson here, I bang my wrist and there may be inflammation, or I sprain my ankle. There's like a local acute inflammation, but this is a different type of inflammation that you're talking about.
Yes.
It's systemic.
So what you're describing is acute inflammation, and that's a very necessary biological process to help speed up healing. So when you exactly cut your finger open, you need some inflammation to bring in white blood cells and to activate your immune system so that your body can repair the tissue. The inflammation that I'm referring to is chronic inflammation, and over a long period of time, your body keeps trying to heal the damage that your body's experiencing from, let's say, inadequate diet or other factors. And however, it is not successful in its endeavors, and it can actually cause more damage. So inflammation is a good thing in an acute process, but however, when it becomes chronic, it can lead to a lot of more severe health problems, one of which is actually cardiovascular disease. Yeah.
Which is pretty serious, obviously.
Yes, it is.
So I was going to ask you next about a couple of tips that you might have for people looking to understand more about headaches from your perspective. And what I'm starting to get a little bit of an insight from here now from what you were just saying was how important a role diet, and I don't want to put words in your mouth and answer the question freely, but the diet can play a big role in headaches, and I wouldn't normally think of that, but since you're linking together the diet to the inflammation and then the inflammation being tied to headaches, I'm starting to see the connection here. Could you sort of follow up on that and give us a few tips for someone looking to understand more about what they can do to treat their headaches from a naturopathic doctor's perspective?
Yeah, sure. So yeah, I would completely agree with you. Diet is a huge factor. But first and foremost, I would like to recommend that people see some healthcare professional to assess their headaches. Because as we discussed, there's different types of headaches, but headaches can also be a symptom of a larger picture. So you do want to avoid any kind of misdiagnosis in this case, or kind of a self-diagnosis. So do seek the help of a healthcare provider that will be properly able to assess the headaches, so to make sure that they're not a symptom of a more serious condition. And if they're not, diet can definitely be very helpful in treating headaches. So one of the tests that we do at the clinic is food sensitivity testing. And what that does is actually helps identify the foods that can be causing the inflammation for each individual. Because everyone's immune system is slightly different, and some foods can provoke inflammation more than others in certain people. So such a thing as a food sensitivity test could go a long way to identify these triggers, and hopefully then the process of eliminating them would give a very beneficial result.
And this ties into the individuality, the individual perspective that you take as a naturopathic doctor. So once again, if there's 10 people coming in for headaches and looking at food sensitivity tests, you're going to do a analysis here, a test, for each individual, and what shows up for one person as them having a sensitivity towards would be potentially completely different for another person.
Exactly. Yes, because not everyone is sensitive to the same things. I mean, some common sensitivities are, gluten or soy or sugars. But again, that's a generalization, and everyone's biology is different. So it is important to find out exactly what the triggers are for each individual person.
Terrific. I think that's some very good insight and great tips for people to follow. If someone was looking to then follow up and visit a naturopathic doctor, could you give them any suggestions on what they should look for or what they should know ahead of time?
Certainly. So I think the first tip is to make sure that the doctor is licensed and registered in the province that they're seeking care from, or even in the country that they may be. Here in Ontario, naturopathic medicine is regulated. So I would go, my first steps would be to go to the Ontario Association of Naturopathic Doctors, their website, and just have a look through the different practitioners. They would list the specialty of each practitioner. Find somebody in your area that you feel comfortable traveling to. And the second tip would be don't be afraid to ask for just a brief meet the doctor visit or phone call to make sure that you are connected to the practitioner on a human level, because this is definitely a process and you want to be very comfortable with the doctor that you're seeing.
So you offer that too, don't you? Some sort of initial consultation to get familiar with the patient, the patient likewise to see what you do and get comfortable with yourself.
Yep, definitely. So we do offer brief meet the doctor visits, and usually what we would do during that visit is discuss what is naturopathic medicine, and I would answer questions about naturopathic medicine to the potential patient. And see if they had any concerns, or just a brief meet and greet, I think, is very important before you start down this long, arduous healing journey for most people.
So I imagine, again, it's going to be a limited amount of time, but it's a good amount of time to get to know you and ask some questions. I imagine they're going to potentially come in with a list of questions related to the symptoms that they're experiencing and just get your perspective on, how you might be able to help them.
Definitely, yes.
Great. So thank you very much for being on the show, Dr. Deshko. I really appreciate this. If listeners wanted to get in touch with you in some way, what's the best way for them to do that?
The best way to contact me would be to call the clinic. The phone number at the clinic is 416-966-4106. Feel free to visit our website, which is www.timelesshealthclinic.com, or you can email us at info@timelesshealthclinic.com.
Great. And you're in Toronto.